You know, we spend a lot of our time focused on the patient, but almost always there's another person in the room. Usually a spouse, could be a daughter, could be a mom, you know, who's there and is sort of the official caregiver. And after my own personal experience as a caregiver, because it is all about me, I recognize that actually that can be the hardest job in the room, is to be that pit crew support. You don't get to have emotions. You just take notes and you get everybody there on time. When in fact, as I say to my patients and their caregivers, it's their diagnosis too. And so tell me a little.
Such a good point.
Yeah,
Yes,
yeah,
it
but
is.
it is.
Cancer affects the whole family.
But really, I think that spouse. But you know, I think
Sure.
about these
It's
people.
the day in and day out of
Yeah.
everything. They're wearing all the feelings, and they're also scared and concerned and having very similar feelings to
Yeah.
the person who's been diagnosed, but they oftentimes don't feel that they have the right to feel those feelings, or they need to be on the very back burner because they have to be present in a certain way.
So do we take care of them different?
Absolutely.
Yeah, okay.
So I know it sounds corny, but as they say on the airplane, you have to put on your oxygen mask before you help somebody else. And I don't think that's an instinct. So we have to be reminded that we need to take care of ourselves as caregivers if we're going to be able to be there for the person we love. It's oftentimes a marathon, not a sprint. And so just having support for yourself, Hope Connections has support groups just for caregivers so that they can be with other caregivers who are going through something similar, and again, sharing the good, the bad, and the yucky, and not have to worry that they're going to upset their loved one.
Yeah, one of the things we're trying to teach our young doctors here is that there are actually two patients in the room when you're doing that, and they have different needs and different issues, and not to just look at the one, but to look at the both, and as individuals and an interaction. So that's really cool. Care for the caregiver.